Hello, this video is a continuation of the previous one. In this video, we will talk about these complications of diabetes and the available forms of insulin. When blood sugar levels stay high for a long time, it can harm different parts of the body, like the heart, eyes, kidneys, and nerves. These problems don't happen suddenly, but they can become serious over time. That's why it's important to understand them and know how to prevent them. The most significant complications of diabetes is retinopathy. It's caused by long-term high blood sugar, which damages the small blood vessels in the retina. These vessels may leak, close, or stop supplying enough blood, and this one is the most common cause of blindness in people of working age. Diabetic retinopathy progresses through four distinct stages. Stage number one is mild non-proliferative retinopathy. At this stage, there is a mild swelling of the retinal blood vessels, known as microneurysms, which can leak fluid into the retina. And the second stage is moderate. The blood vessels may begin to swell and distort. Additional signs may include retinal hemorrhages and cotton wall spots. And the third one is severe non-proliferative retinopathy. Many more blood vessels become blocked, depriving parts of the retina of their blood supply. This prompts the retina to secrete growth factors that can lead to new blood vessels growth. And the fourth one is proliferative diabetic retinopathy, which is PDR, the most advanced stage. PDR involves the growth of fragile new blood vessels that are prone to bleeding, potentially causing scar tissue and detaching the retina from the back of the eye. Diabetic retinopathy is a serious complication of diabetes that can lead to further debilitating eye conditions. And we have diabetic nephropathy. The main idea is that when blood sugar levels remain high for a long period of time, this starts to affect the kidneys, especially the small blood vessels inside them. Over time, this leads to impaired blood flow within the kidneys and increased pressure on them, which causes gradual damage to the cells. In addition, the body begins to release substances that increase inflammation, further contributing to kidneys deterioration. As this condition continues, more kidney cells become damaged and the kidneys become less able to filter the blood properly. One of the early signs is that the kidneys start leaking protein, albumin, into the urine. If blood sugar levels are not controlled, kidney function keeps declining, and this can eventually progress to kidney failure. And the third complication is diabetic neuropathy, is a type of nerve damage or nerve pain that happens as a result of diabetes. High glucose levels damage the nerves directly and also weaken the small blood vessels that supply them with oxygen and nutrients. Over time, this leads to nerve dysfunction and damage. Symptoms usually start in the neck extremities, especially the feet and legs, and can include pain, tingling, numbness, or loss of sensation. At first, symptoms may be mild, but they can get worse over time and may spread to other parts of the body, depending on the type of nerve affected. There are different types of diabetic neuropathy, with the peripheral neuropathy being the most common. Other types can affect the nerves that can control internal organs such as the digestive system, heart, and urinary tract. These next slides show the different types of insulin and how their effects change over time. On the graph, the x-axis represents time in hours and the y-axis represents the relative insulin effect in the body. First, we have the rapid-acting insulin like Lispro, Aspart, Glulisine. These start working within minutes, reach a quick peak, and then wear off in about 5 to 6 hours. They are mainly used to control blood sugar right after meals. Next is the short-acting insulin, also called regular insulin. It starts a bit slower, around 30 minutes, peaks later, and lasts around 7 to 8 hours. It's also used around meal times, but is less rapid than the previous group. Then we have the intermediate acting insulin, known as NPH. It has a slower onset, a clearer peak, and a longer duration of about 12 to 18 hours. It's often used for baseline coverage between meals or overnight. After that, we move to long-acting insulin, detemir. These have a more stable, flatter profile with a minimal peak and provide steady background insulin for up to about 16 hours. Finally, we have insulin glargine is another type of insulin, another long-acting insulin, but it has an even flatter and more prolonged effect, providing continuous basal coverage throughout the day. So overall, this graph helps us compare how quickly each insulin starts, when it peaks, and how long it lasts, which is important for choosing the right insulin regimen for each patient. How to take insulin? It is impossible to take insulin in pill form because your digestive system would break it down in the same way that you digest food. That means that the insulin wouldn't make it to your bloodstream where you need it. So we have different types of insulin. We have syringe, pen, pump, inhaler. Let's start with the first one, which is syringe type. This is a traditional way of taking insulin where you use a needle and a vial. It's actually the cheapest option and it works with all types of insulin, so it's widely available everywhere. But on the other hand, it can be a bit painful and it needs good technique because you have to measure the dose very carefully. Also, it's not very convenient if you are outside the house or on the go. And the second form is insulin pen. This is a pre-filled pen where you just set the dose and inject it easily. It's very simple to use and usually less painful than syringes. It also gives more accurate dosing which makes it very practical for daily life and travel. However, it's more expensive than syringes and you still need to replace needles or cartridges. Also, not all insulin types are available in pen form. And the third type is insulin pump. This is a small device that you wear on your body and it delivers insulin continuously throughout the day. It gives the best control of blood sugar and removes the need for daily injections. It also allows more flexibility with meals and lifestyle, and it can reduce episodes of low blood sugar. But it's expensive, you have to wear it all the time, and sometimes you might face technical issues. It also needs training and regular monitoring. And the last form is inhaled insulin. This type of insulin is taken by breathing it in through the lungs before meals. The main advantage is that it doesn't involve any needles and it works fast for meal coverage. Inhaled insulin is absorbed quickly into the bloodstream, which means it starts working faster than injectable insulin. It passes from your lungs to your bloodstream in less than a minute, and it can start reducing blood sugar levels within about 12 minutes. This can be very beneficial for people who need to control their blood sugar levels quickly, such as after meals. It's also more comfortable for people who are afraid of injections. However, it's not suitable for people with lung problems, and only short-acting insulin is available in this form, so it cannot be used alone. It still needs to be combined with long-acting insulin for full control. It's also not very commonly used, and sometimes lung function needs to be checked. And that's all for today. In the next video, we will go over the most common oral drugs used to treat diabetes. Thank you.